Today is World Diabetes Day. The theme for Diabetes Awareness Month and World Diabetes Day today is Family and Diabetes. The International Diabetes Foundation, IDF, is raising awareness of the impact that diabetes has on the family and also the support network of those affected, and also promotes the role of the family in the management, care, prevention and education of diabetes. Families are urged to learn more about the warning signs of diabetes and also find out their risk of type 2 diabetes. So research conducted by IDF in 2018 discovered that parents would struggle to spot the serious lifelong condition in their own children. Despite the majority of people surveyed having a family member with diabetes, an alarming 4 in 5 parents would have trouble recognizing the warning signs. Now, we take the discussion further now and we speak to Bridget McNulty. She's the co-founder of Sweet Life. It is an online community blog. She joins us now live from our studios in Cape Town. Good afternoon to you, Bridget. Thank you so much for joining us here on SA Today.
Good afternoon. Thanks for having me.
Now, I've given a bit of background on my introduction really on Diabetes Day, the importance of observing the day today. But in terms of the prevalence, more so when we bring it home here in South Africa, 3 in 5 people with diabetes in South Africa are undiagnosed. And it's said that diabetes kills more people than TB, HIV and malaria combined. Surely this is a call for concern.
Yeah, absolutely. And in 2016, Stats SA reported that diabetes kills more women than anything else in South Africa. How is that not front page news? And the terrifying thing about the fact that diabetes is killing so many people in South Africa is that it shouldn't be a lethal disease. It's not a lethal condition if you manage it well. So what's happening, the problem is that because 3 in 5 people are undiagnosed, that means that we're only finding out that people have diabetes way down the line when they're starting to present with complications. And the complications of type 2 diabetes are severe. It's amputation, kidney failure, blindness, heart disease. But if you're diagnosed early enough, it's a completely manageable condition. You might need to change your lifestyle, change your eating habits, lose some weight if necessary, take medication as it's prescribed, but it shouldn't be a condition that's killing people. And that's why we really want to start talking about diabetes more in South Africa.
I was about to ask you, what could the problem be? Is it perhaps some lack of education on the disease, or what could be the contributing factor? Why are we dying in our numbers as women from diabetes?
So it's also the second leading killer of men. So the men are part of are in this with us. But I think the problem is that we don't know the symptoms. I think that's one of the first problems. So there are 5 common symptoms for diabetes. Type 2 affects 90% of people, so we largely talk about type 2. And the symptoms are being very hungry, being very thirsty, needing to pee a lot, especially at night, extreme exhaustion, feeling fatigued all the time, and blurry vision. The problem with those symptoms is that, as you can tell, they're quite common, and you could kind of explain them away as other things. And so what we're encouraging more is to know the risk factors, and if you have the risk factors, to get an annual blood sugar check. So the risk factors are, if you're overweight or obese, that's a huge risk factor. If someone in your family has diabetes, because type 2 diabetes is hereditary. If you have cholesterol or a history of heart conditions. If you had a baby that was over 4 kilos, or if you had diabetes during pregnancy, and if you're over 45. So anyone over 45 years old should be getting an annual blood sugar check, and if you have any of those risk factors. And the check is so easy. That's the part of the story that gets to me the most, is that to get your blood sugar checked, it's a simple finger prick blood test. It takes less than 5 minutes. There are free blood sugar checks offered at all the public clinics and at Clicks clinics throughout November. Many local pharmacies also offer it for free. And you can know within 5 minutes if you need to be concerned about diabetes.
And you talk about being over 45 years as one of the risk factors. Now, it reminds me that last year on this day, I had on the show a 7-year-old who lives with diabetes, and he was diagnosed with diabetes when he was only 4. After that conversation, a lot of people were asking and were saying that they did not know that even children can get diabetes.
So usually that's type 1 diabetes. That's the kind of diabetes I have. So that affects 10% of people. And it used to be known as juvenile diabetes because it was largely diagnosed in children. But now there are older people being diagnosed with type 1 and younger people being diagnosed with type 2. But it is absolutely a condition that can affect anyone, literally of any age. And so that's why it's so important to know the risk factors, but also if you think you might be at risk, just make it part of your annual health check. We all know our HIV status. We should all know our diabetes number.
All right, unfortunately, time constraints. We have to leave the discussion at this, Bridget, but thank you so much for coming through. And I suppose that families will indeed take part in ensuring that they test for diabetes. Thank you so much.
Thank you for your time.
All right, well, there you have it. That's Bridget McNulty joining us from our studios in Sea Point in Cape Town, talking about today being World Diabetes Day. She's also mentioned a number of risk factors, of course, and the signs that you need to be aware of to check if you do have diabetes or not.